Good afternoon, and welcome to today's Social Change Dialogue, Supporting Adolescent Mental Health in the New Normal. I'm Layli Mapayan, Executive Director of the Wellesley Centers for Women, and I'd like to thank you all for tuning in for this discussion. Our program will begin with a moderated discussion panel, followed by a Q&A session where we'll take questions from the audience. A few housekeeping matters related to this webinar that everyone should be aware of. First, to keep things running smoothly, we will disable the chat. We ask that you send all of your questions using the Q&A feature that you should see at the bottom of your screen. We will be monitoring the Q&A throughout the program, and that is where you can enter any questions that you have for our panelists. Second, we're recording the program, and the video will be posted on our website for folks who are not able to join us this afternoon. For those of you who are not familiar with the Wellesley Centers for Women, WCW is a research and action institute at Wellesley College. Our mission is to advance gender equality, social justice, and human well-being through high-quality research, theory, and action programs. For 45 years, we've been focused on shaping a better world for women and girls, families and communities in all their diversity here and around the world. Mental health and adolescent development are two of our key areas of work, and they have never been more important. Nearly all adolescents have been affected by the stress, fear, grief, and uncertainty of the pandemic. With a new school year underway, tweens and teens are grappling with their new normal as they navigate what it means to be back at school in person after, for some, many months of virtual learning. During this time of transition and adjustment, some adolescents may be more at risk for mental health concerns, and school communities can be valuable resources in connecting tweens and teens to the support they need. During this program, a panel of researchers and practitioners will discuss how educators, parents, and school communities can come together to support mental health for middle school and high school students. They'll review how to identify students in need of support, share insights from an innovative school research partnership that addresses adolescent depression, and reflect on how the partnership has enhanced their school community's awareness of and approach to mental well-being for all students. Let me now introduce you to the panelists who will be sharing their expertise with us today. Catherine R. Buchholz, PhD, is a postdoctoral research scientist at the Wellesley Centers for Women. Katie works with Tracy Gladstone on a number of depression prevention research initiatives focused on adolescents and young adults. She is currently collaborating on a multi-year project to evaluate an online depression prevention program for teens. Katie is a clinical psychologist whose past work has focused on trauma and PTSD in college students, women survivors of interpersonal violence, and veterans. She received her doctorate in clinical psychology from the University of Missouri, St. Louis. Tracy Gladstone, PhD, is Research Director, an Associate Director, and a Senior Research Scientist at the Wellesley Centers for Women, where she leads numerous depression prevention research projects. She is also the inaugural director of the Robert S. and Grace W. Stone Primary Prevention Initiatives, which aim to research, develop, and evaluate programs to prevent the onset of depression and other mental health concerns in children and adolescents. In addition to her roles at the centers, she is an assistant in psychology at Boston Children's Hospital, an instructor at Harvard Medical School, and a research scientist at Judge Baker Children's Center. Deanna Canavis DeRocher, EDS, has been a school psychologist at Natick High School since 2009. Previously, she worked as a licensed mental health counselor providing outpatient mental health services through a community agency, a nonprofit organization working with pregnant and parenting adolescents in a Boston public school, and as a family advocate for housing and insecure and displaced families. She loves to travel, spend time with family, and stay active. David Jordan is the principal at Robert Adams Middle School with the Holliston Public Schools. A veteran educator, David was formerly a middle school science and high school biology teacher, as well as an assistant principal at the high school and middle school levels. He's currently a doctoral candidate in educational leadership at Vanderbilt University, focusing his study around the sustainability of equity and inclusion efforts in predominantly white school districts. David is married with 3 children and resides in Needham, Massachusetts, but originates from Indianapolis, Indiana. He has a BS from Indiana University in psychology and a master's of school administration from the University of North Carolina at Chapel Hill. So thank you to all of you for speaking on this panel today, and I hope everybody's ready to dive in. I'm going to throw out the first question. The pandemic has been extremely difficult on tweens and teens, and there's been a lot of concern about its impact on adolescent mental health. In particular, there was a lot of worry about how students would adjust to the new school year and being back in the classroom while still dealing with the effects of the pandemic. Now that we're about 2 months into the school year, what have you observed in your schools in regard to students' mental health? And Deanna, why don't you kick it off?
Okay, great. Hi, thank you. So working at the high school level, I actually have to say that it's been a really great beginning of the school year, and students are, the optimistic piece is that students are really happy to be back in school, to connect with one another. I've worked with students who tend to be anxious about school and some school avoidant, but what we're seeing is actually attendance has really improved. Kids are happy to be back and connected, like I said. There are some drawbacks, some things that are hard for students. And I would say just the rigor, we're seeing that a couple months in, that students kind of getting used to kind of typical school and not having remote learning and some more downtime academically. They're really needing to step it up. So we're trying to have that balance and help support students around their social emotional learning, but also do the academic piece as well. So it's been both, but going well in general.
Thank you. David, what have you observed?
I think very similar to how Deanna responded. I think students are struggling with kind of the endurance, the pace of kind of a typical school day. I mean, it's been a couple of years since they've been back to kind of this state of a typical school day, school week. From a mental health standpoint, I concur that like the kids are pretty happy to be back. Our attendance is pretty good, and our kids are just enjoying being there. I think that the downside is they are very happy at school, very handsy, the behaviors are a little different than we've expected in the past. Whether that's just kind of they've been mostly at home, mostly spaced out, and haven't had kind of these full days. So kind of a takeaway for me is just needing to kind of develop kind of an endurance right now, and that's something they're struggling with.
And I can relate to what both of you are saying, because I have a 16-year-old who actually started high school during the pandemic and now has had to come back. And the social part is really fun, but the academic part has really been pushing her to the limits. Tracy, what have you observed in, coming in as a professional from outside?
I do think that the pandemic has certainly presented some challenges. And so we do have to allow teens some flexibility and compassion as they reintegrate into the school setting. I think, we're not day to day with kids the way Deanna and David are, but we do talk to a lot of kids through our research studies. And we talk to a lot of our colleagues who are in the schools, and we do hear exactly what Deanna and David are saying, that overall, kids are really happy to be back in school. We actually are running one study where we use a group therapy model. And whereas during the pandemic, it was really easy for us to find a time when all the kids were willing to meet for a weekly synchronous group session, now it's really hard to get kids who can fit us into their schedules. I do think, and Deanna alluded to this, that for some kids who found the pandemic somewhat of a relief, kids who maybe are more school avoidant or more anxious about being in school, I think for those kids, coming back can feel especially challenging. And I just think for all kids, and Laylee, as you mentioned with your daughter, I think that just getting back up and running again, reintegrating, reconnecting with their peers, their activities. I think a lot of kids are out of practice at juggling the multiple demands of being an adolescent, being a student, being a peer. I think just it's challenging for some of us to return to the office after being away and working remotely for so long. I think that it does take kids a little time to get back up and running, and that we just need to show them some compassion and some understanding as they make this transition.
I think that's a really important point, Tracy. Compassion is really important here, because these transitions can be even harder for kids than they are for adults, and remembering how much they really have to practice to, become competent at those kinds of things. And I'm glad that you're pointing out how it's harder for some kids than others. Katie, what have you noticed?
So I've had the opportunity to, through this other study that Tracy's talking about, talk to a lot of parents. And so one of the things that I kind of hear time after time from the parents is that in-person school has made a huge difference in their child's mood, that going back to in-person school has really improved their mood, and that they notice their children looking happier and seeming happier, and that reconnection with peers and being able to see their peers every day has been really helpful.
Well, I'm glad that you mentioned parents because that's the perfect segue to the next question. Parents in particular might be very worried right now, especially if they've been reading recent media reports about teen mental health crises driven by the pandemic. What would you say to parents and other adults who are concerned about how the pandemic is impacting a tween or teen in their life? Tracy, why don't you start us off?
I absolutely understand that parents are worried about their kids now, and all of these media reports of this new mental health pandemic among adolescents, it certainly doesn't help matters. I think it makes us as parents more anxious about how our kids are doing and about how the pandemic is going to have long-term effects on our kids. But the literature consistently shows that the crisis in youth mental health predates the pandemic. So we've had a mental health crisis among our kids for many, many years. And my work started in the schools many years before the pandemic began. I think that overall, when I talk to parents now and I hear their worries about their kids, the general message I give is that most kids are managing okay. Most kids are not going to have long-lasting negative mental health effects from the pandemic. I think a lot of what we're seeing is sort of a normal reaction to a very stressful negative life event. And certainly the pandemic did exacerbate some of the disparities we see in mental health. So certainly some kids who had more restricted access to resources, whose parents lost jobs, who lost family members from the pandemic, certainly the effects on those kids are more significant. But overall, I think most kids are doing well. But that said, I also think that this new media attention on the crisis in youth mental health actually gives us an opportunity, a really important opportunity to make some changes that are long overdue. So, if we can turn this media attention into something positive, we know that kids have long been struggling with high rates of anxiety and depression. We know the rates of these disorders have been creeping up in recent decades. We know that our kids and families are still struggling to access high quality, evidence-based mental health services. They're difficult to find, difficult to pay for. Our schools don't have enough psychologists and social workers and counselors to service all the kids in need. So what I'm really hoping is that we can turn these news reports and this new recognition of the current crisis in mental health into positive change in these areas.
Yeah, I appreciate both of those points that, the crisis predated the pandemic and that most kids are doing fine. And I also think that something that, that your important work has shown is that we're also placing more emphasis now on people who are subclinically stressed with mental health. And that's making it seem like more people are distressed because we kind of putting the subclinical people mentally in that same category, but that is a good thing because it gives us opportunity to be more preventive. Katie, what would you add in terms of, for a parent that's just worried about their kid or someone in their life?
Yeah, absolutely. I think it's important to stress we are in kind of an adjustment period. So, this is kind of the time to be aware to keep an eye on kids and see, okay, so as things get more and more normal, are we seeing kids return to kind of what we consider their baseline? If you're concerned, it's a good time to check in with your pediatrician, with the school, with other people. And, I think that kind of Tracy talked about, like, we need more resources and there are resources there for people to check in with right now.
Yeah, that's great. I'm actually old enough to remember when you would take your kid to the pediatrician and there was no such thing as a mental health screen. But at least for my kids, doctor, it's always there now. And that's something that means there's a gateway, even for parents who don't know where to start. So I appreciate you mentioning that. David, what would you add for the concerned parent, grandparent, aunt, uncle, et cetera?
I mean, whether I'm offering up any kind of answers or anything, I think continually having relationships with the schools and conversations with them. We have strong departments, educators, our own school counselors that work with your student, get to see them and notice them in different spaces and settings. And it's important to kind of develop as a parent a strong relationship with those individuals that are in the school. I think additionally, just continual conversations with our student. I mean, I'm a parent where both my wife and I work, and we're constantly looking for time where we can have meaningful conversations with our children. They will fill that void if we are not, and they've got this continual exposure to information that they have through social media or through other forms of media that they have. So, if we can provide models as parents, as families, and have meaningful conversations and relationships with our children, stay connected with the school, I think that goes a long way.
That's great. I really love how you're painting the picture of an ecosystem that wraps around every kid, because you've got the schools, you've got the parents and families, you've got the primary care, you've got just all these entities really working together, and it just takes us being aware of each other. Deanna, how would you advise a parent or a grandparent, aunt, uncle who's worried about their young person?
Similar to, well, what's all been said, but what David was just saying about reaching out to the school and enhancing that partnership and feeling like you can reach out to your, students, guidance counselor or support staff in the school, and whether they provide some kind of referral or information about what to look out for. Sometimes, there's lots of information that we can share as school personnel, and we have referrals, we have symptoms checklists, things like that, just in case a person is really worried. We have hotline numbers, all that sort of thing. I mean, I work at a high school level, and so I have a lot of that information, and I know all of the school personnel who work in guidance and social work have that. So feel free to reach out. You don't have to tell all your business, but just know that the school is a resource there to be supportive. And I also hope that the attention, like Tracy said, I do hope that the attention that's out there will help us get more resources at the schools. And I think that it will as well. So
yeah, that would be great. And I appreciate too that you briefly alluded to the issue of stigma, because I think for a lot of parents, they can really recall a time where they grew up in an era where mental health issues were quite stigmatized. It was a secret. You didn't want to talk about it. You felt embarrassed about your family, your kid. But I think, in fact, thanks to many of the young people themselves and their activism, mental health questions are becoming much less stigmatized. People are more open to talk about them, and no one should feel afraid to step forward. And I think it's important to make that point. All right, so with our next set of questions, we're going to have a chance to really get into the social science, and I'm going to be asking Katie and Tracy about their work. But I want to note that there's already been one question from the audience that I think Tracy and Katie can address after I give you the question, and that is that some people want to know what subclinical means. So I'm going to ask the question, but if you could throw in what subclinical means, that would be great too. So Tracy and Katie, your research at the centers has had the unique opportunity to explore how the pandemic is affecting teen mental health. Can you share a bit about what you found and how we might be able to use that information to support teens, and of course, bringing in the subclinical concept? Katie, you could go first.
Sure. So actually, I'll just throw out the subclinical right now, or sometimes we call it subthreshold. And all it means is someone who might have some depressive symptoms, but doesn't kind of have enough symptoms or severe enough symptoms to meet kind of our classic criteria for depression. And so, you think of someone who's feeling down for a little while, lost interest in some things, maybe has one or two other symptoms, and again, doesn't meet full criteria, but is still struggling. That's kind of that subthreshold range.
Yeah, thank you for explaining that. So now you guys can get into your research.
Yeah, so we had the opportunity to go back into the schools after the COVID-19 lockdown. So we had earlier that year, about 2 to 4 months before the lockdown, we had completed some school screenings and screened 7th, 9th, and 11th graders. And so we went back and rescreened about 2 months after, I think it was May, June, 2 months after the lockdown, to see how students scored differently on measures of depression, anxiety, and then we also gave measures of resilience and kind of cognitive style, negative cognitive style. So this was early on in the pandemic, and it was kind of that first jolt of being locked down at home, losing social connections or not having the same types of social connections. And so what we found was that while there was a significant increase in depressive symptoms, again, many kids were doing okay. So it's kind of what you would expect as kind of a normal reaction to a really bad situation. So we saw that significant increase in depressive symptoms. And then we also saw kind of an interaction. So the measure I didn't add in there was a measure of COVID distress. So kind of how distressed they were feeling about COVID, some situational factors that might make COVID a more intense stressor for a student. And so students who reported higher level of COVID distress and lower levels of resilience had greater depressive symptoms. And likewise, students with higher levels of COVID distress and more negative cognitive styles, so like interpreting things in their environment in a negative way, had higher symptoms of depression at that second time point after lockdown. And so really what that's suggesting is that there were some individual differences in how students were kind of approaching their experience that contributed to some symptoms of depression. Tracy, you can add to that.
I think you did a great job summarizing our study. I mean, it was such an opportunity for us. We felt so honored that the school let us come back in to do a second assessment of the same kids. It let us, of course, also provide support to kids. So if we identified at that second assessment that kids are really struggling, we were able to provide them with some additional support. So it was helpful to the kids in that regard. It wasn't just for the sake of our research project. I think, as Katie mentioned, I mean, we did show that symptoms of depression increased significantly, but it was a very minor increase. So the overall rate of depression in these kids as a group was in the, mild, like none to mild. And afterwards, it was still none to mild. So it was a little bit higher, but it wasn't past any level that would really concern us. The highest increases were among females. So, and that's consistent with what we know, that females are often more impacted by such negative life events than males, and rates of depression are generally higher in females than in males beginning in adolescence. So this is consistent with what we knew anyway. And I also think, as Katie mentioned, that we saw individual differences in how kids respond to traumatic events. And we found that there were certain protective and vulnerability factors that will determine how kids respond to difficult experiences that they may have. I think another thing that was exciting for us is that our outcomes were very consistent with the literature as a whole. So just in the past few months, new reports have been coming out from other groups that have had sort of a longitudinal sample of the same kids before and after. And most of these studies are showing the same thing, that symptoms go up a little bit. They're not super concerning, and it's a more significant increase for females than males.
That's a great overview. And it's making me wonder, what the cohort effects are going to look like over time, when we check back on these kids 10 years from now, what we're going to see. But, let's pull the lens out wider than just the pandemic period. I know that for the last 5 years or so, Tracy, your research team has worked with local public schools to support mental health for middle and high school students. Can you talk a little bit more about the partnership? Maybe you can describe it, and then David and Deanna can weigh in with their experience of working with your team.
Absolutely. I love to talk about this program because it's really a chance for us. So much of what we do is sort of in our offices and research. And this is actually an opportunity for us to be out in the field and meet with kids routinely and talk to kids and talk to parents. This program started, 5-6 years ago with support from the Metro West Health Foundation. And we started in the town of Natick. we developed the program because we had found through our research and through assessments we were doing as part of our research that kids were very comfortable sharing very personal information about their mood and how they were doing when they were asked directly. And we realized that so often kids are not asked directly how they're feeling, sort of in a broad way. But when we ask kids, we find that they will talk. We also knew from the literature that kids are often more comfortable sharing information about mental health and other personal topics with people they don't know so well. There's a bit of a benefit of some anonymity, that they don't have to worry about disappointing people they know and care about. And the other thing we found is that in the literature is that school screenings in general can overwhelm school staff if they have to attend to lots and lots of kids that are picked up through screening. And so based on this, we developed a sort of broad-based screening program that had 3 steps. The first one is really to increase mental health literacy in a whole school community. So that means working with school staff, administrators, and teachers to recognize the signs of depression and suicidal thinking and behavior in kids and how to respond to any signs they see. Also educating parents. So we've had a lot of meetings with parents to talk about when they should be worried about what they're seeing in their kids and what their kids are expressing. And then we also included in the step 1, it also includes direct work with kids. So exposing kids to information about depression, what the signs are, what the symptoms are, when to be worried about themselves or a peer, what to do if a peer expresses suicidal thoughts or feelings to them. So the whole first step is about increasing mental health literacy in a community. And then in the second step, we do a broad-based screening of all students in a designated grade. And we've done it in different districts in different grades, but screening all 7th grade students or all 9th grade students for symptoms of depression and suicidal thinking or behavior. And more recently, we've added in anxiety. And then in the third step, we actually meet individually with all students that we flag. And we flag students for any number of reasons. And we flag about 30% of the students that we screen. So a very high percentage. Any kids who express past depression, high levels of depressive symptoms or now anxiety symptoms, any kids who talk about having suicidal thoughts or feelings ever in their lives, or sometimes students will we give students an opportunity to just say they want to talk to somebody. So even if they aren't endorsing a lot of symptoms, we invite them to talk to us about themselves or if they have concerns about a peer. And then we meet individually with all these kids. We do a fuller assessment. We reach out to parents and we share in broadly what we find in the assessments. We share any concerns we have about their kids. We help connect them to resources in the community or in the school that can help their kids to sort of follow up if their kids are expressing significant symptoms. And then we offer follow-up over time. So we'll call back families a few months later to check in, see how the kids are doing, see if they need any other referrals. So we try to sort of, in these 3 steps, educate the community, screen everybody, and then give some special attention to kids and families who need some special attention.
Yeah, that's really remarkable. David, what is it like from the school's perspective to be part of this?
Well, I think anytime a family is or a child's in need of support, I think there's also kind of an affordances issue to look at through like an equity lens. Typically, when there's not, or what Tracy and her team has been able to provide is been able to reach out to or identify and provide assistance to families that maybe their bandwidth or their ability or their advocacy to get resources is limited. When parents are kind of left to their own, it's challenging to seek out those and have the perseverance to get those resources, the literature, the information they need to read to identify what they need to advocate for their student is a challenge. And with this partnership, the relationship we've had with Tracy and her team has been to be able to kind of do a lot of that work, not only kind of the identification, but then able to support the families and kind of carry them through that. That also kind of helps us as a school who, our resources are very thin. I'm a strong advocate for greater resources, but still it's a public school as far as like what we're able to be able to provide. So it's been for us, it's been fantastic. I'm a big proponent and supporter of universal screening of mental health. And I couldn't speak more highly.
Oh, that's great. Deanna, what has your experience been like?
So it's similarly, I feel it's, very appreciative and lucky that we were able to have this screening go on since the beginning of when Tracy and her team started it. And I think we've all learned a lot. And one of the things I really appreciate is the piece that Tracy talked about with the anonymity. That I think it's really true that there's families, there's kids who really might talk to another person, another stranger, as much as that can be difficult sometimes for staff, that they disclose things to someone from the outside who's not a part of the public school or the high school. And I feel like I appreciate that it really catches some kids that we really had no idea that they're struggling in that way. So it's been really crucial in certain circumstances, and it's really helped to educate the school community. And that includes, students, parents, and our staff over the years. And I think we'll talk more about that, but there's really been a shift. And I think a lot of people and their understanding, like you said before about the stigma, a lot of people understand mental health much more. And then in addition, the resources that Tracy is able to provide, or the referrals, and knowing that somebody else has their eyes on this young person too, and is working with this family. And sometimes we find out about who that student is and that family because they want our help from the school perspective too. And sometimes we don't, but at least we know they've been screened and are getting help if they need it.
Well, that's true. And the bottom line, more kids are getting help, which is what makes this wonderful. I know that you all talked about that within this school partnership, the team identifies students at risk of experiencing depression. I'm sure that a lot of the people in our audience are wondering what actually happens when you find a student who's at risk of depression, and why does this program focus specifically on prevention? Can you say a little bit more about that? And also, if the program identifies students who are already experiencing symptoms of depression, what happens then? I think people just want to understand the process, the steps, what happens next. Katie, can you speak to that?
So I'll stick kind of to the more why prevention, why we're trying to catch kids there, and then I'll let Tracy kind of answer the rest of it. So one thing with depression is it's episodic. You have a depressive episode, and then if you have one depressive episode, you're more likely to have more depressive episodes. And so it kind of gives us a natural place to do prevention work. We try to catch people and teens and students before that episode of depression or in between episodes of depression. If we can kind of catch them then and teach them skills, new ways of responding to their environment, learning new ways to interact with other people, new ways, kind of new cognitive styles, new ways of thinking, and identifying kind of what might make them feel more down, identifying what to do when they're starting to feel down, to engage in other activities. We can really try to give these kids skills that prevent them from that downward spiral of getting to depression. We can kind of turn it around and teach them ways to turn it around. And so we can make a big impact through kind of targeting that prevention aspect. So I'll toss it over to Tracy for the rest of the question.
I'm sure I can talk to you a little bit about what happens with the kids we identify at different levels of symptoms. I mean, I definitely agree with Katie. Our overarching goal, really in all the work we do, is to prevent depression in young people. But in any effort to prevent depression, you're going to find kids at all different levels of symptoms of depression, and they all need different things. And so we really make it our business to give the kids and the families what we think the kids and the families need. So, from the most basic level, as a prevention program, even for kids who have no symptoms of depression at all, our education piece, going into the classrooms, teaching about how to recognize signs and symptoms of depression, starting these conversations in schools with parents, in communities. There's a preventive umbrella there, right? Because now kids know what the symptoms are. They know if they're feeling a little bit off, that they can identify it better. It starts conversations between kids and parents, between kids and guidance counselors. We hear from kids sometimes that they recognize themselves in one of the videos we showed in a scenario they saw. So sometimes it's just at the really early level, before kids are showing many symptoms at all, we're at least educating students and we're educating the community. We're giving language to talk about what kids are experiencing so that if things do get to become more difficult for kids, they'll know what to do and they'll know how to express it and they'll be more comfortable talking to their parents about it. Sometimes when we screen kids, we'll get kids with, as you were talking before about a subsyndromal level of symptoms. They have some depressive symptoms. It's not really concerning. We can meet with kids. We can talk with them about those symptoms. We can help them to talk to their parents about their symptoms. We can help them start conversations with their parents, help parents to know when they might want to step it up, when they might want to get their kids some support. We can introduce the idea of getting some mental health support to kids. Sometimes we find kids who are quite symptomatic that maybe parents don't know about, maybe the school doesn't know about, and then we're able to help kids to let their parents know how they're feeling. Sometimes kids just want somebody to open the door and start the conversation. We always ask kids, do you want to tell your parents or do you want us to tell your parents? And almost always kids want us to tell their parents. Then they can have the conversation afterwards, but they want us to sort of open that door a little bit for them. And we do. Sometimes we talk to kids who are already in treatment and what we find can reinforce their treatment. Sometimes we actually hear from kids who were in treatment but are no longer in treatment and they want to resume treatment, but they don't know how to tell their parents that. They don't want to disappoint their parents. So they don't know how to kind of have that conversation, and we can help them with that conversation. Sometimes we find kids who are in treatment, but they've been holding back, that they're really struggling with suicidal thoughts or feelings, but they don't want to tell their parents and they don't want to tell their provider. We can tell them, we can help the kids to tell their parents. We tell parents routinely, and it's really, they're hard conversations for us to have with parents, but ultimately we want to know, we want parents to know so that they're able to get the kids what they need. I mean, I think overall the strength of the screening program is that we can offer support to students and families regardless of where they are, regardless of what kids are experiencing, and we can sort of carry them through the whole process.
Mm-hmm. That's great. You haven't mentioned it. I know it's not a focus of your research, but I'm wondering if you've noticed anything anecdotally about how increasing the mental health literacy helps kids have supportive conversations with each other about mental health. Have you noticed anything to that effect, particularly those of you who may be in the schools and may have, noticed what kids are talking about?
Yeah, I'm happy to kind of tackle that. Tracy did speak to a little bit about like language as far as giving students and children language that they can understand. For us, they can kind of like create schema or scaffold in their mind as far as like some of this, as far as the understanding the feelings they're having. Middle school is just, it's a moment of significant change, chemically, physically, mentally. And anytime we can kind of arm students with education and understanding, they can, as they kind of confront and see that in their life and recognize that feeling, they have kind of an understanding, language to put around it, structures to put around it. And I think that's important.
Yeah. Deanna, have you noticed anything about peer-to-peer communications about mental health in your setting?
Yes, I would say certainly students are very interested in supporting one another, and often it's easier for them to bring one of their friends to get some help, and they notice that there's some symptoms, some concern, something coming up, and that they have a particular symptom that might, they might need to see a guidance counselor or someone. So I feel like that's from them hearing and learning and researching. There's also an interest in mental health overall, where students this year at our school started a club where that's about prevention of mental health issues. It's not about like a support group after school. It's about, let's get information out there. So they're doing their own research so that they can provide that to one another. And so that's kind of a neat way that we've seen it really grow, and them wanting to learn more and share with one another.
Yeah, that's wonderful, because you can really see the seeds of change in the whole community. And that sort of leads to the next question, where I really wanted to ask you, Deanna and David, first. From your perspective, how do students benefit from having mental health support in schools compared with other community and healthcare settings? I know you've addressed that a little bit already, but I'd just love to hear you say more about why it's so important to have mental health support in schools, particularly if there are any policymakers listening who need further justification of why we need more people in our schools.
Well, for one, I would say, and after working in outpatient mental health for a school, in and out of a clinic, but also working in a school, the advantage is huge, in my opinion, of being able to make connections with students, being able to see change happen over time. You can really watch kids grow and learn. Like I see some kids freshman year and then senior year, and you're able to watch them build their skills. You teach them something, you see them implement it. You're working on some kind of conflict resolution or some skill they need to work on. It happens in the moment. You can get in there with them. They can problem solve. They can go back out. They can try it again. So it's really, I love being able to be in the school, because I think it really, you have all the consultation with the teachers, with the parents. It feels like you can really be a support in a different way. It doesn't, there are pieces certainly that there are advantages of being outside, but I feel like there's a lot that we can do in our relationships with kids that helps them to learn and grow and to teach us. I mean, I feel like I learn so much from kids all the time.
I think your point about the immediacy is really important, because with teenagers in particular, they move so fast, and to have something where they need it right there when they need it in the school setting, that's a great point. David, what would you add?
Yeah, I mean, we spoke to this earlier, but the idea of wraparound services, and Danica said this, the idea of being able to, observe a student through time as they're in your setting, regardless if they're having a good day, bad day, anything, including when we look at kind of services or things that we're providing pre-K through 12 as a student makes their journey through the system. We keep notes on that. We have an understanding of major life events that are going on in a child's life. Also, when maybe a student is meeting with an outside provider or whatever that would be, and an intervention or something is discussed, it's then put into action in some other outside setting. For us, we can discuss the intervention. They can then go into the setting and observe how the student is utilizing that intervention, and then help that student kind of as a facilitator, help them kind of make modifications to whatever that need is. So, it's incredibly important.
I mean, that makes a lot of sense, because where do students spend more time than in school? I mean, that's the major setting of their lives for so many years of their lives. Tracy, what would you add about the importance of having mental health care services in schools and how we really want to make that case?
I always just go back to the literature when I'm trying to answer these questions, but the literature does tell us that many kids are much more comfortable receiving mental health services in school than they are going to specialty mental health settings. And actually, we also know that kids are more likely to complete treatments that are delivered in a school setting versus a specialty mental health setting. We also know that schools can overcome a lot of the barriers to accessing mental health care. So a lot of times when I'm talking to parents and I'm trying to convince them to let me share their child's screening results with the school, I can use the benefits that schools can offer. So a lot of times it's hard to find somebody to treat kids outside. It's hard to, there's limited availability. Transportation is tricky when parents are working. It's hard for them to get kids to an appointment. There's also a lot of stigma to going to sort of see a shrink outside. A lot of families are uncomfortable with that. So a lot of the barriers to access and use of mental health supports can be overcome by focusing in the school setting. So we always do try to encourage families to let us share screening results with the school and try to work with the guidance counselors and other social workers and psychologists in the schools to sort of partner with them around providing support to kids.
It makes a tremendous amount of sense. Katie, what would you add?
I mean, I think I'd just echo everything that was said. I think that kids spend so much time at school, and being able to have interventions right there where they already are, you can reach so many more kids. So it really increases access to mental health services. And then that in vivo component, that the kids are there. That's where kind of conflicts can come up, difficulties can come up, and the people working to support their mental health can see that and address it in that moment or in that environment. So it's just so important for so many reasons.
Thank you. Tracy often talks about the ways that school communities that she's worked with have grown in their comfort with discussing mental health and well-being over time. And of course, the issue of stigma and destigmatization has come up a little bit during our conversation. We've talked about how maybe we've seen some changes with regard to kids talking to other kids, but of course, school is more than just kids. Have you noticed any changes in the way that your school community approaches mental health issues? This may be the teachers, this may be other staff, anything else that you've noticed? And I'm asking this specifically to David and Deanna. David, why don't you kick it off?
Yeah, I mean, you mentioned stigma, but also as part of it is once we've kind of gone through it a few times, people have kind of less fear around it. They see what it is, they see what the outcome is, they see that the world's not going to explode as a result of it being done. So it's we've been doing it for several years right now, and our teachers are comfortable with the conversations that happen in the classroom. Our students are, and compared to some of the kind of like the early years, kind of the initial year, you have a lot of parent response, wanting kind of a parent night to discuss it, just the uncertainty of what this is. We don't have nearly that anymore. It's just kind of seen as like, oh, this is another thing we do in 7th grade and at the high school, and we kind of go through.
I love that. Deanna, what have you noticed?
Similarly, that over time, the whole community, teachers, students, and families just have a greater understanding and appreciation. I would say that in the beginning, I'm sure it was a bit of a disruption, and Tracy and her team were always amazing at like understanding sort of the working with the school and bringing in new things. It can be a little tough at first, but I think it's like David said, it's an understood important piece of the screen of what we do to understand students at the high school level, and in the middle school we also do, but doing it for 5-6 years now, I think people know it's a really important piece, and there's really no complaints or issues about it because they know how important it is to understand the mental health issues and to screen the students. So it's been a really great partnership.
That's great. And I appreciate how you both have referred to the fact that it takes time for that new piece of school culture to evolve, but that once it does, it's really sustained and durable. I think that's a really important point. Now, I want to turn everyone's attention to a recent report that was released by the Department of Education that outlines the challenges that schools face in providing mental health support. And it offers recommendations to create systems of support for students and their families. From your perspective, what is the biggest challenge that schools face in providing the mental health support that students really need? This would give you an opportunity, for instance, to talk about, what would an ideal support environment look like? How might we think about funding what's actually needed? This is really a chance for you to dream out loud about what could be possible, just in case somebody who's listening can do something about it. Let's start with you, David.
Yeah, I mean, other than kind of like the simple standard answer, we need resources, but how do we, I mean, this kind of goes to kind of like why I support the universal screening, as well as like, how do we do kind of research-based work? How do we collect this kind of data and understand kind of the mental health needs of students? And then how do we have the resources and the wraparound services around that to kind of support that? Oftentimes, due to low resources or due to just a lack of understanding or knowledge within the school system amongst our professionals, we are kind of going off of like anecdotal information and are trying things that we don't have the resources, capacity, or knowledge to validate whether it's effective or not. So oftentimes it's the idea of like throwing some spaghetti against the wall and seeing if it sticks. We don't have the ability to, or the skill sets to kind of really work with professionals, implement, and this kind of even goes into like the void that exists sometimes between research and practice and implementation inside the setting, is that like there's that kind of gap that occurs. Oftentimes the schools are just kind of thinking what might work and trying that as best they can. So, for me, my ideal world is be able to, have the resources to strengthen that partnership with academia and the school setting and implementation, a closer bond there. Better trained and more mental health providers within the school system, and an understanding and positive relationship with other kind of agencies within the Commonwealth. We oftentimes are working with the Board of Health, with DCF, with other groups that are providing kind of more this wraparound, and they may own a piece of that pie, but oftentimes those pieces kind of get lost in the kind of the muddiness that exists. So something that can pull that in.
Yeah, it'd almost be nice to have some kind of one-stop shop for all things children and youth mental health, where people from those different entities could be in the same room, in the same conversation, around the same table. So Deanna, what is your wish list? How would you dream out loud with regard to this center?
Well, I love what David just said. I think having the time as well to be able to get the information and be able to do the research and have the evidence-based practices for us to be able to implement. I also, and of course, the funding for more staff, mental health resources, but also being able to develop those partnerships with teachers and in the classroom. So I know we have a lot of teachers who are interested in social emotional learning. I mean, and that's been something that we've been doing across the district for a number of years, but really being able to go in and do that kind of work and partner with teachers, I think that would be really wonderful. And when I say that, I mean really like infusing curriculum into what teachers are doing and allowing them to have the time to do it and the training to be able to do it. It's not to take away from the other curriculum that they're already teaching, but to really add to it. I think teachers have been asked to do that as we came out of the pandemic, and they're trying to, but they're also trying to get through all of the chemistry for the whole year. You know, it's hard, but really, so figuring out how we can really work together and have enough resources, because I know so many teachers also feel the same way, and they want to be able to teach those fundamental SEL skills and take care of their students and get through the curriculum. So it would be also working on that level as well that I would like to see.
All right, that's great, because it's true that all of us have the kids' best interests at heart, and we all want to, see it get done. We're all trying our best, but to make sure that everybody's workload is appropriate to the task, the training is in place that needs to be there, and all the partners are there. That's so important. Tracy, from the researcher's seat, what does the ideal scenario look like to you? How would you dream out loud about this, having the resources in schools?
I think I agree with everything that David and Deanna said. I think that I'm just thinking about some colleagues that I'm working with now in Louisville, and the model that they have, which to me, I just have in my head is a really good model, but where they have a mental health clinic embedded within the school. And I think that, when I think about general health care, primary care, and then I think about mental health care, and having a system where those sorts of care are available to students, sort of in the school building, in the neighboring building, a community health center kind of model. I think that one of the challenges we find in our school screening, and I think it's been exacerbated now post-pandemic, is that it is so difficult to find providers for kids. So even when I bring news back to schools, I know this is going to happen when we start next month in David's school. I'm doing some screening, and we're going to identify tons of kids, and we will hold the families. We will talk to the families. We will help them sort of with the transition to care for their kids. But, we say how we want to share with the school what we find, and yet the school's resources are so limited. It's hard. The school wants to take these kids from us, but they don't have the people, they don't have the resources, and having somebody having a building or a clinic just down the hall that has a full sort of mental health, kind of a full complement of mental health providers available to kids. I think, from sort of pie in the sky, that would be an amazing thing to have. And I know that's what they have in Louisville, and some of these schools are working with. And I feel like it's those kids, it reduces a lot of barriers to care for those kids, and it lets there be more conversations. I think that, the town of Holliston has a really lovely youth and family services program, which I'm just putting a big plug in, because they do some of that wraparound. They do have mental health folks that come into the school and collaborate with the guidance counselors in the school, mental health support folks. But I feel like we need more of that, and we need it to be kind of a more natural extension of what the schools are offering, so that it's easier for kids and families to access the care that kids need.
Yeah, I love that vision. It's very expansive and it's like we're migrating, and the more people, more schools, communities we can get in that direction, the better. Katie, what would you add? What's your dream?
I mean, again, I think it's very similar to what's already been said, kind of having the evidence base to be able to know what's going to be most helpful, to increase resources so that we can both get that evidence base and implement it. And then I love the idea of having a mental health clinic, right there embedded in the school, and with providers. I know that, kind of at the higher ed level, on this other study that we work with, when I work with a college student who I need to refer for services, I just ask them the name of their college. I see the college counseling center. I'm like, okay, call, and then they're immediately connected. And so something like that throughout education it would be so helpful.
That really would be a dream. We're starting to get some really good questions from the audience. And if you don't mind, I'd like to actually transition to some of the audience questions now. So I'm going to sort of share them as they've come in. One says, what special mental health challenges have you observed in students of color, LGBTQ plus students, et cetera? And what additional resources can you access for these youth? I'm going to actually kick that to David first, because David, you mentioned equity issues. You may have observed things in your school, but I'd actually love to hear from anyone who has something to say about that question.
Yeah, so this is kind of some of the research I'm kind of currently immersed in at Vanderbilt is around the idea of like communities of practice and kind of, which is this idea of kind of old timers, new timers, but basically like legitimate peripheral participation. So this idea that you have like being in a predominantly white school, if you're white in that space, you're part of that community of practice. And therefore anybody who is outside of that always feels like new or an outsider and has limited access to different resources or affordances from that standpoint. Within kind of like a school setting, being consciously aware that a student of color is going to constantly feel different in that space, and it's important, especially in our area and predominantly white schools, like how we work on that. We do, as a school, we offer like some social justice clubs, a GSA as well. But as a school system, if we can develop like kind of sustainable equity practices in our school system, so it's not just about providing diversity, and diverse experiences, as much as the way we educate is for all and provide space for all. Is incredibly important. You want all students to be able to see themselves in representation of themselves in the space that they work in, and feel that they are meant to be there. We have seen in the past and are constantly aware of those who are just kind of having to struggle with their identity and their place in the school, and whether they're being represented there, or whether they feel like they have to try to hold their authentic self. And that's something kind of very, very much at the forefront of our teachers, of our equity work at the school, but also as far as like our guidance counselors and how they work in the school. So that's, it's one thing to be aware, but this is the work right now. This is incredibly hard and challenging right now, but we're doing everything we can at the moment.
I appreciate that. Would anyone else like to jump in with their experiences or observations?
I can just say at the high school that we have similar kind of programming and classes and clubs and things to support students, but I think also having staffing where students feel like they have folks that they can connect with and have trusted adults, and that's something we're really conscious of as far as hiring and making sure that kids feel like they're connected, and staff as well. I mean, this is something in the district where we have staff groups as well, so people feel supported and understood and not just out there on their own. I think just having the conversation be open, and we do have a new social justice class, and we have a lot of people who are super passionate, but they also, there's that important piece of everyone listening to one another. I feel like it's a big, it's an initiative and something that is our leadership are really looking at and trying to make sure that and making sure that like students' voices are heard, because I know, you know, being an adolescent is hard enough, and you can feel different and like not understood, and then adding an equity piece or feeling different even more so, like it just makes things really hard. And so making sure that we're all listening and trying to do what we can to support students. I think we're really working on that as well. It's certainly a process.
Yeah, I think that's important because schools are really the laboratories where kids learn a lot of this stuff. This is where they learn the ideas. This is where they get the chance to practice them. This is where they can get, you know, course correction and, you know, all of that. So I appreciate what you're saying. And I also am thinking about myself, about how certain other kinds of community connections can help enrich that kind of ecosystem that we're talking about. For example, some of our staff at Wellesley Centers for Women are involved with a local organization called Out Metro West, which is for LGBTQ plus kids right in our area. And, you know, understanding that schools can potentially have relationships with organizations like that or other things that support students of color, different ethnic groups, you know, whatever experiences reflect the diversity of the school, that those can be community partners as well that can also support mental health. Because for many students, particularly students who are not part of the mainstream, however that's defined in their school, there's always, you know, often the starting point for mental health concerns is just simply the part of not feeling that they fit in with that identity. And so if that's a, you know, a point where things often jump off, that's often a real obvious intervention point. So I'm glad there's such a robust discourse around that. Deanna, we did get one question from the audience where people asked about how staff are doing, especially teachers, in the return to classroom this year and their own well-being and also supporting students' needs. Since you mentioned how teachers are doing, could you say a little bit more to respond to that question?
Sure, yes. I would say in general, I feel like similar to what I said about students at first. I mean, there was some apprehension around coming back, but mainly people were really happy, although staff were back full-time last year, but without full groups of kids. And in general, at the beginning, I think people were, you know, happy to be back, to be social, to be with kids, to be around one another. But I do feel too that the rigor, similarly, we're seeing kind of some stressed out folks and trying to figure out how to take care of themselves, take care of their students, take care of their own, you know, families, and be able to get through their schooling. And I do know that the message has been from, you know, leadership, administration, like, take care of your students, take care of yourselves. You don't have to get through all of this material, but it's really hard to do when that's the content that you're teaching and you want to get through it and it's important and there's MCAS and all those things. But I do know, so I feel like we're seeing that as time goes on, there's just a bit more stress and tension around that, I would have to say. But, you know, hopefully people feel like they're able to do that a bit. I do feel like those social connections and people, you know, staying after school and chatting with one another, all those things that are happening now too, though, are making school a more rich social place for people, and like that community for staff has been built and continues to be built. But I do see that there's definitely the stress level.
Well, I appreciate that you mentioned that and that you're acknowledging it, because even though it's not the topic of our webinar today, it's such a huge piece of the puzzle and it's such an important issue in its own right. And I hope we get a chance to focus on that at some point. Tracy, I want to ask you a question, because this one is a very practical question that you as a researcher can probably answer. This person asked, did you encounter concerns from parents or kids around rights to privacy or HIPAA violations in the school-based care? Did that come up at all?
Yeah, it has, you know, I think David mentioned that in the first years that we were in programs, or in different school districts, that we heard more concerns like this than we have heard more recently. I do think that we are very careful to, parents are told about the screening program before the screening happens, and they're invited to opt their kids out, and they can privately opt their kids out by contacting somebody at the school, so that we don't know that their kids are part of the grade. We don't know that they're not being screened or that they've been opted out. So parents do have the option to opt out their kids. We generally have no more than a handful of kids opted out. So we screen about 96-97% of the kids in any grade. So most parents are not choosing to opt out their kids. They're given a lot of information about the program. They're given a lot of information about privacy. We do not share any screening results with the school without explicit permission from parents to do so. So we hold that privately and are able to sort of keep all of our care of kids and families outside of the school. And we do this with IRB approval, which means we have approval from the Institutional Review Board at Wellesley College, and now Wellesley College contracts with Brandeis University. So this program, this protocol has been reviewed, and we have that just in place so that there's protections in place so that any data we collect is kept private and de-identified and locked up. And so we really do all of the things that one would do. This isn't a research program, but because we share data, because we talk about what we found, we do have an institutional review board keeping an eye on what we're doing and making sure that we're protecting kids' rights and kids' privacy and families' rights and families' privacy.
Okay, thank you. Because it's true, we do follow very robust and rigorous consent procedures, and we follow all of the federal and other kinds of ethical protocols. So I appreciate you explaining the details of that. Here's a person who's interested in whether group treatment is an option that's offered to students, and whether, and this person says groups can be a wonderful way to address the resource issue. If groups are offered, are they organized around identified vulnerabilities? I don't even know who the best person is to answer that question. So anybody who feels that you can, please jump in.
I can kind of answer part of this a little bit, and Dana, maybe you can expand upon some of this as far as it relates to NATIC. But within the school system, we have students who have social emotional learning goals that are on their IEP. We have students who have kind of things that we've identified within a 504 or some external services that they're receiving, where we will create lunch groups or different groups as well, and work on explicit kind of interventions or explicit kind of identified things that we're targeting as well, and documenting and monitoring kind of progress on that.
Okay. Here's a question. Oh, did you want to address that also, Deanna? Did you want to jump in?
I just would, sort of the same thing. And it gets a little more logistically challenging at the high school level with schedules and stuff, but we do try to group students if we are able to, because it certainly does help. And it helps students, have that peer interaction and learn from one another as well.
Okay, thank you. All right, here's a question that says, kids have gone from 0 to 60 in the last 2 months, leading the American Academy of Pediatrics to declare a national state of emergency in children's mental health. How do we have the conversation with our schools, administrators, teachers, parents, and kids about changing school culture to be less stressful and pressured and support the mental health of our kids? That's a bigger question, but I would love to hear everyone weigh in on it. So why doesn't everyone take a turn? In fact, Katie, since we haven't heard from you in a while, I'm going to let you jump in first.
Yeah, I think that opening up these conversations is a really important thing, and opening them up with the schools is an important thing. I think, listening to David and Deanna today, I think this is also something that schools are really open to hearing and talking about, and figuring out how to, fit the social emotional piece and support in with the curriculum. And I think that these are really important conversations to, if they haven't been started, to bring up, to, go to the school, ask how things are going, and what they're talking about within the school, to bring parents into the sphere of conversations that are going on. So it's a great question.
Yeah, what do you think, David?
Yeah, I mean, anytime we can kind of work to have kind of this universal screening, to be able to like have this work done in the schools, I can't tell you how how happy I've been kind of having that access to that as has been discussed here. Is this is it's a big question. I mean, we still continually have conversations as a community on what our goals are as a community and how we reach those. But being able to, strategically look at, like, collect kind of research or collect data on and understand kind of like the impact of any kind of intervention that we're trying to place. When we're trying to like move the needle on the mental health of students, we need something that we can kind of root that in, and this work has been able to help us do that.
Mm-hmm. Deanna, what are your thoughts about how to think about a less stressful school culture?
Well, piggybacking on what David just said, in Natick, we are doing universal screenings of looking at social emotional learning again, and like school connectedness. And that's something that's going to be done across the district. So we can get some baseline data of how kids are doing right now, how connected they feel, so that we can really look at, when they are surveyed again, we can look at, are there changes? Are our kids as stressed out as we think, although we know they are, but what are the particular areas? How can we intervene? And what, but really having the data to look at before we decide where we're going to jump in. I think in general, overall, like I said, I do feel like the message is this is really important, but I do feel like the high stakes testing and things that are like above our school district, do impact kind of the decisions that are made and the stress that folks feel. And, yeah, it's difficult. I know it's a big issue,
Tracy, have you thought about this stuff?
Well, you'd think by being the fourth person that you've asked this question to, I'd have a really good answer. And I don't. I think this is pointing out a tremendous problem. And I'm glad, Deanna, that you mentioned that high stakes thing, because I feel like it's all well and good for us to sit here and say there should be less pressure. But if parents are finding that their kids are not being as successful in college admissions as they want them to be, then there's going to be backlash against the schools from that end. So I do think that the challenge is great. And I think that, as Katie mentioned, there needs to be more conversation. And I think the more we can integrate mental health care into the schools and into sort of routine education for kids, the more we can educate kids about attending to their needs personally, the more we can educate parents and families into understanding kids' mental health needs, the better we'll be. But I'm frankly glad that I'm in my office at Wellesley College and not trying to run a school during this very difficult time, because I think that these are really very, very challenging questions.
Yeah, it's really true. And I have to admit that this question makes me ponder whether there are going to be changes in our larger culture on the horizon that are going to filter down into schools just by default. Because when you think about, for example, the questions that people are asking during this period of the so-called Great Resignation, when a lot of people are looking at their lives and saying, I don't want to slave over a low-wage job with crazy schedules where I can't do anything else or see my family, if that train of thinking leads to a different approach to work in general and a different approach to how we interpret stress in life more generally, inevitably that will eventually affect how we approach school as well. And another factor that I think could influence it is as we look at how the jobs landscape is shifting, and we think about how, for example, we put a lot of emphasis on kids going to college, but yet there's this great void in many of the trades and other occupations, and how in some respects we've got to recraft some sector of public education to address that gap more effectively, that too is going to change a little bit of how we think about life and think about the relationship between schooling and life, and in turn what we have our kids do in school to prepare them for their lives ahead. We had one interesting question from someone who said that they were curious about the curriculum emphasis. They wanted to make sure that students are getting their physical and health education, and they asked whether we as a country are bringing back civics education, critical thinking skills, and media literacy. And even though that question didn't have to do with mental health directly, it made me wonder about the relationship between other classes that aren't explicitly related to mental health and how they might actually support mental health. For example, does having critical thinking skills help people have less stress or help people think in ways that are better for their mental health? Or does civics education contribute to conflict resolution in ways that improve mental health? Or, does physical education make sure that that physical exercise gets those endorphins running? It made me wonder about the relationship between the rest of the curriculum and mental health. Do any of you want to opine on that?
Yeah. So Massachusetts does have civics in 8th grade. So middle school level, we definitely have that. One way that I'm thinking about this is, one of the stressors that like our teachers are dealing with right now is this pressure, this external pressure to recover from COVID, to help our students kind of what they've lost, like learning loss, are almost bad words in our school system as far as like how we think about that. And with that, when we're focused on this learning loss, we unfortunately become very focused and centered around content and MCAS and assessing certain things. And what I feel like we're losing are some of those intangibles that are harder to measure, which are around critical thinking, are around like the social emotional learning and how do we implement it in those schools. I want to get better at how we kind of assess and understand whether having an impact around critical thinking or some of the social emotional learning components. But oftentimes those assessments or those tools are way more kind of in depth than like a simple like content-based assessment. And sometimes that's the easiest way for us as a Commonwealth to kind of move forward with that. But it is like our ability to kind of critically think. I think that that's something we've lost in the last 2 years that we've noticed inside of schools. There's a way we presented material to students over the last 2 years was in a very simple kind of way, something they could access from home. What was missing were kind of like those social components, social dynamics that were brought by being in a classroom and being confronted with different realities, conflicts that they had to struggle and persevere through. So when we can provide those types of experiences inside of school, that's where I feel like are the true needs that we need to, or how we look at school differently. So if the workforce starts to prioritize like their own lives, what is that trickle down effect? I'm hopeful that it is. We're moving towards more of a school-based kind of wellness, mental, physical well-being that we have. So I want to include more physical activity. I want to move more time, create more time for reflection in the classroom, and more around kind of like social emotional learning and their understanding of themselves and their impact on others as well.
Yeah, that makes sense. I mean, it reminds me of that old saying, a sound mind and a sound body. We do need that holistic approach. So I have a question here that I knew that we would get at some point. And so that is, what suggestions do you have about how grandparents specifically can support their children and grandchildren with regard to mental health? Any special suggestions for grandparents? Sometimes they're a little bit more removed from the proximal things that we're talking about, but for many kids, they're a huge part of their lives. So what would you say to grandparents?
I think grandparents are awesome. And I think that there's plenty of space in kids' lives for active, engaged grandparents. If you look at the literature on the whole on resilience and how to promote resilience in kids, we keep finding that for kids, having an adult outside the home that they can that they can connect with, a supportive adult outside the home, is actually a primary factor in promoting resilience in kids. So when I think about grandparents, I think for kids, having somebody who they might not see every day and might not be monitoring their homework as much, or might not be telling them what to do, but somebody that they can sort of go to and kind of trust and engage with in that way could be really, really helpful. So I think there's a huge role. I think as many adults as kids can have in their lives who are going to be loving and supportive, that's just better for kids.
Yep, that's really a great point, and very much supported in the literature. All right, so I'm going to ask the last question for today. And it's actually one of the first questions that we got. The screening program that you described sounds so important for every single school to be doing. How do we get our child's school to consider bringing in more resources to diagnose, do screening, and educate parents, faculty, and students about all of this? Or stated differently, if somebody wants this program in their schools, what can and should they do? Tracy, I'm going to turn that one over to you.
Yeah, I guess that comes to me. When we started this program, we started in one school district, and we were just sort of exploring how what the possibilities were around it. I think we have found tremendous possibilities. It's been very, very successful. We moved to Holliston several years ago. We actually have another school district that we're starting to work with now. There's not a huge infrastructure. There's not like I don't have a website, but if you email me, I'd love to have a conversation with any school district that's interested in adding the school screening program. I think that we really view this part of what we do is a labor of love. You know, we have research grants that bring in overhead and support our work more broadly. This is really just a sort of we charge what it costs us to do it. And we really feel like we have a lot of direct access to kids and families. We have such positive interactions with parents. We actually hear from parents years later. So sometimes we'll screen a child and we'll follow the child a little bit, and then we think the child's all good. And then a couple of years later, we'll get an email from a parent that has hung on to our contact information to ask us about another child in the family, to let us know how their child's doing, to ask another general question about accessing mental health support. So we really do try to be as supportive as we can to as many people as we can. And we would certainly entertain as many communities as we can physically manage to serve. We certainly feel a responsibility to serve, and we'll do our very best.
And I guess, you know, one of the things I can say with pride as the executive director of the Wellesley Centers for Women is that this project, Tracy, as we both know, started off as a pilot, kind of an experiment based on a hunch. And it turned into something really wonderful and valuable where people almost can't get enough of it now. So, you know, I almost just want to say, if there's somebody out there that is looking to make a grant or a gift and can't figure out what to do, this program could expand. You know what I mean? I mean, maybe it's not my job to say that right now, but I always think about that because this is proving to be so good for so many young people, and it's really making a difference in the world. So with that, I think we can round it up today. And I really want to thank Deanna and David, especially for joining us today. And of course, Katie and Tracy for joining us in this conversation about this incredibly important topic. I also want to thank everyone in the audience for attending our program this afternoon. As I mentioned at the beginning, a recording of the program will be posted on our website within the next week, and we'll email a link to the recording to everyone who registered for the program. Please visit our website to register for our next social change dialogue, Sounding the Alarm, Speaking Out Against Workplace Harassment, Discrimination, and Labor Abuse. The program, which will be moderated by NPR's Linda Wertheimer, will feature 3 Wellesley alumni's powerful experiences calling out labor abuse and their vision for a better future. Thank you and goodbye.